just give folks a few minutes before we get started. Well, welcome everyone to the virtual town hall at the Center for Advocacy and Social Justice at the Jacksonville Urban League. We're pleased to have with us this evening Dr. Frank Catalanotto, an expert in the area of access to oral health, or the lack thereof, particularly in areas of underserved communities. And it's with great pleasure that I will introduce our intern, Maura Mittner, who will do the introduction, and also mention that we have several interns with us: Aubrey Gerhardt, Jamie Krasnogor, Sophia Berger, Sasha Wilson, and we're grateful that they're helping us on these town halls and the recordings, which we can then share with the community downstream. And we're also live streaming on Facebook, and we'll have people watching there as well. So with that, I'll turn it over to Maura.
Hi everyone, my name is Maura Minter. I'm a pre-dental student at Johns Hopkins University, interning for the Center of Advocacy and Social Justice, and it is great to see everyone here today. This town hall will discuss the oral health disparities facing Florida's communities of color, and I'm very excited to introduce our speaker today, Dr. Frank Catalanotto. Dr. Frank Catalanotto is a former dean and currently professor at the University of Florida College of Dentistry. His professional interests include social responsibility, oral health inequities, and racial equity. Dr. Catalanotto's current advocacy efforts are focused on new emerging oral workforce models. He is a vice chair of the National Coalition of Dentists for Health Equity and a co-chair for the National Partnership for Dental Therapy. He is a founding member of Floridians for Dental Access. Some background on this organization: Floridians for Dental Access, or the FLDA, was started in 2018 by Dr. Frank Catalanotto in collaboration with the PEW Trusts in Washington, D.C. Dr. Catalanotto has been a long-term advocate for dental therapy since it started in Alaska around 2005 and has provided legislative testimony in a number of other states. When asked why we didn't have a similar effort in Florida, he always responded, "You don't know how powerful the Florida Association is in terms of lobbying the state legislator." The Future provided initial financial and advocacy support to the organization, and it quickly grew to over 65 organizational members in the state who recognized the access to dental care problem and the solution that could be provided with dental therapy. Currently, Floridians for Dental Access receives funding from CareQuest to carry out its advocacy work. We are focusing on two major goals. The first is educating the public and legislators about the access to care problem, and second, how dental therapy can be one of those solutions to improving access to care for all. So this town hall is also going to follow a interview format, so I'm just going to ask Dr. Frank a few questions, and he's going to give me some of his responses. So
Maura, before you get started, just one comment I always need to make before presentations like this, and that the viewpoints that I'm expressing are my own and don't reflect the viewpoints of any of the other organizations that I am associated with. So just a little housekeeping to get started. Thank you.
Okay, so the first question that we have is, how can you describe the access to oral healthcare problem in Florida?
So you could use lots of words like horrible and a mess and one of the worst state country. But let me give you a couple of examples of what I mean by that. So Medicaid, in Medicaid for people and children who are on Medicaid, and in Florida we're talking about over 2.5 million kids that are on Medicaid. One of the things we look at is dental utilization. Dental benefits are mandated for children. They're not for adults in our state, but they are mandated in all states for children. And our Medicaid utilization rate is only about 40%. And when you think about that, with 2.5 million kids, that's a lot of children who don't get dental care on a regular basis, and there are bad consequences for that. Another good example might be hospital emergency room visits. So when a patient who cannot afford to go see a dentist in private practice has a bad toothache, they go to the hospital emergency department because they know that legally hospitals are required to see them. And in 2019, and we have pretty similar data in 2020, we've got over, in our state alone, 150,000 visits to the hospital emergency department because of a toothache. And in addition to that, if that infection that they go for to the hospital is so bad that it's life-threatening, a lot of patients get hospitalized. And again, in those years, 4,300 patients had to go and be admitted to the hospital because the infection was life-threatening. Another measure we frequently use, and this is a national measure across the country, is unfilled cavities in children. And we specifically use third grade, so every state can make comparisons. And Florida is one of those states that does data. And again, we're about 5th or 6th from the top, the worst in the country, with about 23% from untreated cavity, which could go on to some serious consequences. So, you know, it's a mess is the way I describe it in Florida, one of the worst states in the country in terms of how folks can access, get quality dental care.
Awesome. So our next question is, why is good oral health so important? For children, baby teeth are going to fall out anyways.
Yeah, so, you know, I'm actually a pediatrics dentist by background, and you know, parents don't understand that comment that you made. Well, they're only baby teeth; they're going to fall out anyway. But what we now know in the science is that cavities in baby teeth are a good predictor of cavities in adult teeth. So you don't want that. And the other thing that can happen, I can't tell you how many children, as a pediatric dentist, when I was working in San Antonio, Texas, for example, we were in the operating room 3 days a week doing 2 or 3 children under general anesthesia because they had so many cavities in their mouth that they couldn't be handled in a dental chair. So that's all well and good to describe that as a consequence, but what's the real issue? So the real issue with children is we now have lots of scientific evidence and data, over 20 papers in the scientific literature, that poor oral health has an impact on school learning and school performance. And one of the things I remind people of is, what's the way out of poverty for a child on Medicaid or a child coming from a poor family? The key is education. And if you're in dental pain, we know from studies you don't learn as well as other children. Okay, so that's children. But why is it important for adults? And this may shock and surprise a lot of people. But again, we now have pretty good scientific evidence that if you have periodontal disease, gum disease, it affects the management of your diabetes. It makes your diabetes more difficult to control. If you have periodontal disease, gum disease, you are more susceptible to cardiovascular diseases. And there's a whole litany of other diseases where we have seen this relationship. There's a famous study from the Blue Cross Blue Shield insurance company that has both medical and dental insurance, that people with poor dental health live 2 years less. Their average lifespan is 2 years less than people with good oral health. So this is really important. This is not just a dentist trying to hustle business for more dentists and get dentist business. This is an important issue. And the tragedy in our state and other states is that people don't get dental care because they cannot afford to get dental care. And so they go without, they develop these dental diseases, and they develop the consequences.
So for the next question, is access to dental care more or less difficult for all people in Florida?
So that's a really good question. A friend of mine has ran Dr. Caswell Evans, who actually was on one of these town halls a year or so ago. He said that the patterns of dental disease is not random across the population in the United States. And what did he mean by that? What he meant by that is that there are certain groups of people that have more or less disease than others. And there's two specific groups. First, racial and ethnic minority groups. Blacks have much higher levels of dental disease than white populations. Native American Indian groups, some of the worst oral health in the United States, and Latino groups in particular. The other way you can look at this as a segment of the population is that poor people in general have poor oral health than middle income and higher income individuals. And virtually every study, every epidemic will demonstrate that very, very clearly. Same here in Florida. So this is a disease that particularly affects poor people and racial and ethnic minorities.
For the next question, what do you feel is the biggest barrier to dental health care in Florida?
So it all depends on who you ask. So if you ask dentists, you'll frequently get the answer. It's poor choices on the part of patients. They don't properly spend their money on what's the appropriate things that they should spend it on. That is simply not true. The two big factors are costs and poor oral health literacy. And one of the more recent papers demonstrating the cost issue actually comes from the American Dental Association Health Policy Institute. And it is not just poor people. We are seeing cost barriers in middle income folks who don't have dental insurance. Okay, so if you look at, I did this once as an exercise for our dental students, looking at median family income in Florida, and at the time I did it, it was around $42,000 a year for a family of four. And if you looked at going to the dentist twice a year for each member of that family, and one member maybe needing a couple of fillings, just a couple, one of the adults and one of the children needing a couple of fillings, the costs were around $2,000 to $3,000 a year, 5% of that family's annual income. They've got to pay for housing, they've got to pay for food, they've got to pay for transportation, and things like that. So it's cost. It's plain and simple costs. The
Florida. You finished discussing the cost barrier, but then you cut out right before discussing the second barrier.
Yeah, so the second issue is what we call oral health literacy. People just don't understand how important dental care is. This is not an issue of, oh, they're just baby teeth and they're going to fall out. As I explained earlier, if a child gets a tooth that's infected, it's going to cause a lot of pain, and it's going to impact their learning. For an adult, as I also explained earlier, the relationship between gum disease and periodontal disease and oral and diabetes or cardiovascular disease is quite clear in the literature. So it's an important issue, and one of our goals is to educate the public, and that includes policymakers about the importance of this and why we have to do a better job in Florida. The economic impact and the societal impact of poor oral health is a big deal, and we need to pay better attention to it.
Thank you. That was a great answer. For the next question, what are some of the proposed solutions to improve access to dental care in Florida?
So there are what I like to call the old solutions and then the new solutions. So if you were to ask the Florida Dental Association what we should do about this, one of the things they're going to say, first of all, is that, well, there's really not a shortage of dentists. There's a maldistribution. We need to find incentives to get dentists to practice in poor communities or to work in more rural areas. And so one of the things that's been proposed nationally, and that does have a short-term benefit, is loan forgiveness for dentists to go practice and set up in a rural community or an underserved community, or to work for an organization like a federally qualified community health center that sees patients for a sliding scale fee. The problem is that's only a short-term effect. Dentists will go work in that rural area, and for the most part, when their loan forgiveness is done, they leave. They'll go to work for an FQHC, and for a while they pay off their loans, they're happily employed. When that employment is over, they tend to leave. When that loan forgiveness is over, they tend to leave. So I support loan forgiveness, but it's a short-term, very expensive measure. Well, what else could you do? And again, this is a legitimate complaint on the part of the Florida Dental Association. But we have some of the worst Medicaid reimbursement rates in the United States. The state of Florida could raise Medicaid reimbursement rates. Two problems with that. First, it'll never happen in our state with our legislature. They are cheap. They're interested in giving tax cuts to corporations. They're not interested in services to the public. But the other thing is that the literature on that, the scientific literature, what happens in a state when you raise the Medicaid reimbursement rates? You only get very small, sometimes none at all, or it's a very modest increase. So those kinds of solutions don't work. Third solution, again, Florida Dental Association is very proud of this. They have what they call their missions of mercy, and they occur all around the state. They'll pick a Saturday or Sunday. Lots of dentists and dental assistants and other folks will volunteer. They set up tents with portable equipment, and they give away a lot of free dental care. Wonderful philanthropic activity. However, what the media doesn't tell you is some of those patients had to stand on line for 24 hours in the rain or in the heat or overnight. That doesn't sound like healthcare with dignity to me. It doesn't establish a dental home for these patients. So what else can we do? So this is where dental therapy came along. Dental therapy is a dental therapist are members of the dental team. They work under the supervision of a dentist. They get trained according to the same standards as a dentist done, certified by an organization called the Commission on Dental Accreditation. They are much less expensive to educate. They go to school for 3 years. I, as a dentist, had to go to school for 8 years at a minimum. Their education is less expensive. They're less expensive to employ. And what we're seeing in those states that have now passed dental therapy legislation, in particular, I would point out Alaska and Minnesota, where they've got the longest track record. Without a doubt, the literature is very clear. They are improving access to dental care because they lower the cost of getting care. It's very, very clear. So that is a solution that I and a number of other organizations, the Pew Trusts that you mentioned earlier that funded our efforts, CareQuest, a national foundation and grant giver, and now 13 other states have passed legislation to bring on dental therapy into the oral health care team. So that's the answer for Floridians for dental access, and that's what we're trying to do.
Great, thank you. The next question is, what are the political barriers that we are facing for the dental therapy initiative to pass?
So it's really simple. I've seen it in every state where I provided legislative testimony, and that's about 8 or 9 states. There's usually only one organization that opposes dental therapy, and it's what we call organized dentistry. So in our state, it's the Florida Dental Association. Nationally, it's the American Dental Association. And you know, as you said in the opening comments, my remark has been, when I would go around to other states and talk about this and do my legislative advocacy, people would say, Dr. Catalano, if this is so great, why aren't you pursuing this in Florida? And you know, my joking but sincere response was, you don't understand how powerful the lobbying and PAC dollars of the Florida Dental Association are in trying to stop us. They are absolutely unequivocally opposed to bringing this on. They will argue it's not necessary. It is necessary. Just look at the data. They will argue they're not safe. And then I tell them, okay, give me evidence that they're not safe. Do you have any evidence from the 100-year literature around the world, the 15 years of experience in Alaska, the 11 years of experience in Minnesota? And then there's silence. Or they'll say they're not educated correctly. But wait a minute. Their education is certified by the same organization that certifies that a dentist is qualified to deliver the services that I'm able to do. So, and they continue to hold that position. So there, I mean, there's a little modest good news. So in a couple of states like Michigan, they passed some great legislation in Michigan. 1 or 2 other states, the dental associations have stayed somewhat neutral about it, neither opposing nor supporting, but their members individually still spoke to legislators. So that's our opposition in Florida. That's why we're in our 5th year of advocacy work to bring this to Florida. And it's going to take us a couple more years, but I'm hoping we're going to get there as more people understand the problem and the fact that dentists are, I'm going to hate to say this, but I'm going to say it bluntly, dentists are just lying about the quality, safety, and cost effectiveness of dental therapy.
Thank you for your answer. Going off of that question, what specific things can people and organizations or the general community do to help the issue of inadequate dental access in Florida?
So there's a couple of things. Join our organization as an individual member. Just Google Floridians for Dental Access, and there is an opportunity to sign up to receive our mailings and our notices and our requests at the right time next fall to speak to your legislator. Tell your legislator
your local representative, your local state senator, or your local state representative, that you want to see this happen in Florida. If you're an organization, go to the website and then contact me directly. And we can talk about being an organizational member. There are no dues, there are no financial costs for joining this. We just want people who are willing and able to speak up for the underserved, speak up for the folks who are not getting dental care in our state, and let legislators know that this is something you want.
Hi, Frank. Good afternoon.
Hi, how are you?
Doing? How you doing, Doctor?
I'm doing fine. Good to see you.
Good. I just wanted to say hello and to say hello to our interns. Wow, how fortunate we are to have such talented young people working with us on this, Frank. So
I agree.
just want you to know we're very supportive up here. We're doing what we can do, and we haven't given out on the statewide effort. Okay.
Great. Fantastic. Thank you.
You're welcome.
Thank you. Okay, so the next question is, what can people do to help the efforts of the FLDA? Kind of going off of the last question.
Yeah, well, again, it's the same answer. Get on our mailing list and respond when we send out a request to speak to legislators. We'll be doing that probably later this summer to fall. We're in a sort of a quiet period now. The legislature's coming back into session for 2 special weeks, but they don't cover any other issues during that. But the most important thing at this point is join the organization, get on the mailing list, and speak up when we ask you to speak up and talk to legislators.
Thank you. The next question is, how will the education of a dental therapist work? Can you walk us through the logistics?
Yeah, so there's we already have one college in Florida that is said up front they're going to support that and offer a program, and that's Miami-Dade College. We have other colleges that have expressed an interest in this. And again, I'll be very blunt, they've dropped out because of political pressure put on by the Florida Dental Association. So it takes 3 years of education in a state college is what we're hoping for. We would prefer not to see this program in larger universities. We want colleges that appeal to local residents. And Miami is a great example. Large number of minority groups, large number of lower income folks who can afford to go to Miami-Dade. Maybe they can't think about attending a university program because of either geography or because of the costs. The Commission on Dental Accreditation, as I've said, is the organization that for dental assisting and now dental therapy. They have passed educational standards. And essentially what they demand is about 3 academic years of education. Why am I particularly excited about this happening in Florida? So in Minnesota, let me just give you this as an example. The tuition at the state colleges is about $35,000 a year to become a dental therapist. In Florida, tuition and fees are estimated to cost about $20,000 for the entire 3 years of education. This makes this profession so accessible to a person, a young man or woman with lower income levels. The college may or may not, it's up to them, require some prerequisites. It's up to the college about whether they give a degree or not, but it could be an associate's degree, it could be a bachelor's degree. And as I said, Miami-Dade is ready to go the moment we pass legislation and put on a program. And I can guarantee you, without naming names, there's several other colleges that are very happy, looking forward to this. They just can't come out publicly and support dental therapy.
Great, thank you. The next question is, what benefits will be seen from adding this new dental therapy position?
So the first thing, so I mentioned before federally qualified community health centers. These are organizations that provide medical and dental care, usually to low-income individuals, and they use a sliding scale based on the person's income. Well, you might imagine it's to hire staff. They're working on a smaller budget, and they're always struggling to hire dentists to fill positions. They would be the first places where I think we'd love to see dental therapists go and be employed, because it's going to help those FQHCs deliver care at lower costs. They can also work in private dental practices. Our legislation, similar to the legislation in Minnesota, requires that 50% of the patients seen by a dental therapist have to be on Medicaid or otherwise underserved or lower income. But Medicaid is the big criteria. What we saw in Minnesota is exactly what we would hope to see here. Dentists who did not take Medicaid started taking Medicaid. They actually made more money. I don't care. That's great as far as I'm concerned, because as long as 50% of the patients seen by the therapist were on Medicaid, the other 50% of their time could be seeing other patients in that practice, paying the usual and customary fees in that dental practice. And so a number of dentists that I've spoken to in Minnesota are happy to employ dental therapists. Most of them currently work in safety net organizations, but a large number of them are in private dental practices in Minnesota. And I got to tell you, the irony of that is that these were the same dentists who opposed dental therapists in Minnesota 12 years ago, 13 years ago, when it got started. But they started to see the benefits of this. And at the same time, again, making more money. I'm fine with that, but doing a social good, because a whole bunch more patients who are on Medicaid were starting to get services, dental services that are greatly needed. So that's what I see as the big advantage. It's going to take time. Any one program is not going to graduate more than 10 or 15 a year. But if we can get 5 or 6 programs going in our state, in the state college level, imagine what the effect would be 5 to 6 to 7 years later, with 75 to 80 of these dental therapists graduating every year and going across the state. It will take time. This is not going to be an immediate solution, but that's what I see as the big advantage in Florida.
Thank you. That was a great answer. And then for our last question, we have, what can we do to make dentists feel more comfortable with having this new dental therapy position? Do they feel as if they are competing with the dental therapists? And how can we fix that mentally?
So, there are the dentists know the stories about what's happening in Minnesota, that their colleagues in those states are now rushing to hire dental therapists because it's good for the practice. We need to appeal to their professional ethics. By seeing underserved patients, Medicaid patients in their practice, they're doing a social good. I mean, dentists are good people. Well, I've got a bunch of friends that are dentists, such as myself. But they're afraid. They're afraid of competition. They don't understand the true facts. They don't understand the true need in this state. Again, just think about, if I've got 1.5 million children that are not getting dental care, I need hundreds and hundreds of dental therapists to take care of them. Their dental therapists are not going to be a competition for private practice, fee-paying patients in a dentist office. It's not simply not going to happen. So we've just got to continue to talk and try to educate and try and share knowledge about how successful it is in other states, how safe it is, how cost effective it is, and how it can be good, not just for patients, but for the dentists themselves. It can be actually good for their practice.
Thank you.
Here. So are there any other questions from other people in the audience? I'd be happy to try and answer them.
I had a question. Given the fact that at the federal level, there's been talk of expanding Medicare to cover dental, or Medicaid to cover dental, is that an indication that people are beginning to see the need to provide more access to dental care, particularly for those of lower means?
That's a great question, Dennis. It was a very exciting late winter, spring for those of us who are advocates for oral health. We got so close to having a dental benefit in Medicare, people over 65. And if they're on, now you got to understand, so Medicaid dental benefits are optional by a state. They can choose to do that or not. Medicare, so again, let me give you the bad news here. When Medicare was implemented around 63, the organized dentistry opposed the inclusion of a dental benefit in Medicare. Okay. Same thing happened this winter. We got so close, and the Dental Association went on full-scale attack, and dental benefits got taken out of the Medicare reform legislation that was passed. That's the bad news. What's the good news? The good news is folks starting to wake up, and low income seniors. Again, I'll relate this back to, if you have poor oral health, you have gum disease, you're going to have difficulty managing your diabetes, you're going to be more susceptible to cardiovascular disease and other issues. So policymakers are starting to get it. We just have to figure out a way to beat the PAC dollars and the lies and the misinformation. I'm being as blunt as I can, but I'm being absolutely honest and straightforward when I tell you this. Again, it was an exciting spring. Bernie Sanders and others were really pushing this hard. Senator Sanders absolutely gets it. I've testified in front of one of his congressional committees a couple of years ago about this, and he absolutely gets it. Now, the issue with dental therapy is that state dental practice acts are determined by states, not by the federal government. So that's why we have to do this on a state-by-state basis. But a great question.
Another question. This is a
Any other
Navy town. Lots of veterans, lots of people serving the military. What's it like in the military in terms of dental practice and care? Is there something equivalent to a dental therapist there?
Oh, that's a great question. So the military during times of high need, during war, the Korean War in particular, and the Vietnam War, did use expanded function dental assistants. They couldn't do all the things that a dental therapist can do, but they could do a lot of other things. They could fill teeth, for example, after a dentist cut out the tooth decay and made an appropriate preparation. They could do fillings and stuff like that. And the issue of veterans care is also a big, dental care is also a big deal issue. Just last week, in Fort Worth, we had our National Oral Health Conference. That's the conference for public health benefits, dentists, and other advocates such as myself. And there was an entire discussion on how to improve access to dental care for veterans during that meeting. This is one of those areas where the VA could make a decision to employ dental therapists if they so choose. And it's an avenue we are pursuing independent of a state dental practice act. So we'd love to see that as an opportunity.
So kind of in the same vein, but using private quasi-regulation, would it make sense for us to have a series of town halls focused on professional ethics for doctors, dentists, and the like, and explore the issue of, we're a member of the Population Health Consortium.
Mhm.
And for years, Dr. Goldhagen, who was director of public health, used the idea of quasi-public regulation. Say, for instance, if the UN sets a standard for children, we should be following that standard, even though we haven't signed the treaty. So could we begin to explore this from a case of ethics, looking at ethics as a whole, addressing the needs of the public relative to access to care, and it would cover obviously underserved communities, but even perhaps seniors.
Yeah. So you remember when Maura talked about my biography and my interests? So the term we actually use is social responsibility as opposed to ethics. Mm-hmm. You're correct in using the term ethics, but looking at it in terms of social responsibility, and that is language that is well known and well accepted. So corporations mm-hmm. follow their social responsibility to be good citizens, to be good members of society. All right. Maybe they should pay more taxes as one of the ways to show their social responsibility, but that's another issue. So, taking a social responsibility approach would be an interesting one in terms of trying to at least have better conversations with dentists about the need, making sure they really understand the need, making sure they really understand it's not a matter of bad choices on a patient's part. It's a matter of they really can't afford it. Their fees have just gone out of sight, out of the reach of many folks. And to help solutions, dental to make care strict of the practice acts we have in the state of Florida, so that dental hygienists can have more direct access to patients. So this idea of social responsibility is a good one.
Yeah, I actually teach business, and social responsibility is a thread that goes through most business courses, and indeed, the freshman course, foundation course in business, not only focuses on the idea of social responsibility, ethics, but also moral decision making. That just because you meet the code doesn't necessarily mean the decision you're about to make is morally right. So again, I think it might be this might be a thread that we want to follow. Again, working with you and the dental field and the Population Health Consortium, I would imagine there'd be people in there who'd be interested in a series of town halls discussing that.
Yeah, so, you know, without getting too personal, one of the, there's a series of articles written by a medical ethicist, Dr. Edmund Pellegrino, going back to the 60s, that really had an impact on me personally. Social responsibility. He used the term moral responsibility in a lot of his writings, and why I've did a turn in my career in terms of the kind of things that I focus on and support. It's exactly for these reasons. And as we get to the current world, then raising the issue of racial equity and racial in oral health as a driving force in our discussions. Good questions, Dennis. Thank you.
Thank you. Others, questions for Dr. Frank?
I actually had a question. I know you talked about the example of the dental therapy position in Minnesota. I was wondering kind of like what makes that situation different to Florida? Like why are Floridians much more resistant to that position being?
So it's not just Florida. It's every state, every one of those 13 states that have passed legislation has been with a several-year fight. And in 2 of them, in the 3rd or 4th year of the fight, the Dental Association sort of said, okay, we're going to stand neutral. We recognize you're going to win. So it's not just Florida. What happened in Minnesota was a passionate legislator who took this on as a personal issue, and an advocacy organization that was well funded and had some very strong leadership. But I will tell you, what he said to me, one of the dirtiest fights he's ever been in. He's a long-term legislative advocate. He's been doing that kind of work for years. And when they passed dental therapy legislation in Minnesota, you know, about 13 or 14 years ago that they actually passed the legislation, it was a struggle and it was a fight. So it's not just Florida. It's all across the country. I mean, I spent one cold winter day in Bismarck, North Dakota, meeting with legislators and meeting with the Dental Association. Dental Association, no, we're just not going to do this right in front of them. It's just the position they take. And even in North Dakota, as small as their organization is, they have enough clout to stop this.
Do you think maybe it's like a lack of legislator support then? If there were more legislators interested in like forwarding a bill like that, then
yes,
forward?
Yes, that's a good question, Maura. We have legislative support for this. We've got bill sponsors in the House and Senate. It just couldn't go anywhere. What happened last year, it has to be heard by a committee first before it can go to the floor for a vote. Absolutely stopped the legislation. She wouldn't even allow it to be heard in her committee. So guess what organization strongly supports her re-election campaign? Not going to name any names.
Thank you.
Yeah, so we've got legislative champions and we'll get them again when the time is right.
Other questions for Dr. Frank? Well, with that, I want to thank everyone for being here. We learned a lot, and we learned, I think, what we could be doing going forward. Really grateful, Dr. Frank, for all the work you're doing on this really important cause, and we're pleased to be partnering with you on this. And I want to thank Maura and all the other interns that have been helpful with these projects. This is recorded on, it'll be available on YouTube, and we'll be able to continue to spread the word about this via this video. And so we're very grateful. And with that, we'll sign
Great,
off.
thank you very much.
Thank you. Look forward to
Great,
continuing to work with
appreciate all the questions. Thank you.
you. Take care. And everyone have a wonderful evening.
You as well, Dennis. Thank you.
Thank you.